Hi, somebody just joined the call.
Yes, Robin Sully. I just joined the call.
Hi, Robin.
Hi.
I think I'm Christina Said with Lung Cancer Canada, and I believe Durhan Rieger Wong is the other person that's on the line. She's from Rare Disease.
I'm just here with sort of from Myeloma Canada. I think David Mullen will be joining us too.
Perfect.
Hi, Durhan.
Hi, how are you?
Good, thank you.
Hi, Rose just joined.
Hi, Rose.
Hi, who's that?
It's Christina from LCD.
Oh, Christina, how are you?
Good, how are you?
I'm good. I haven't seen you in a few months.
I haven't. No.
Unfortunately.
I'm sure we'll have plenty of opportunity to work together.
Yeah, it sounds like quite a roller coaster year ahead.
For sure.
That was riveting TV yesterday evening.
I think there's somebody else that's...
Hello. Yeah. It's Antonella from Canadian Psoriasis Network.
Hi, Antonella. It's Rose.
Oh, hi, Rose. How are you?
Long time no talk.
Nice to talk to you again.
Yeah, same. I was just saying it was riveting television, reality TV yesterday with Jody Wilson-Raybold's testimony. I could not.
What's that? Sorry, Rose.
I said I was just glued to my TV. It was hard to walk away and actually get things done.
I know. I had also the Cohen test. I know it's different, but everything was blowing up yesterday. Like the Cohen testimony was on, and had that on the background, and it was just like my blood pressure must have been up just vicariously.
No doubt.
Hello.
Hello.
Hi, David.
Hello there.
Hi, David.
Hello.
Oh, hi. Hi, Robin. How are you?
Good, thanks.
I think we're waiting for Louise and a few others to join.
So it's Durhan. I apologize. I'm going to have to be in and out because we've got events going on for Rare Disease Day. We just came out of a question period at Queen's Park where there were a number of questions that were raised with regards to the new announcements. But so I'm just in and out at the moment. But it was actually quite fascinating in terms of the discussion taking place and certainly the questions raised by the NDP health critic and the answers that Christine Elliott gave.
Oh, interesting, Durhan. Can you share those?
It's Antonella. I'm looking up Hansard right now. I can send out, I don't know if they've posted anything yet, but I'm happy to send it out to the group once they do post the transcript.
Thank you.
Yeah, just in really brief, and I'm going to have to jump into a train. A question raised around the closing of beds and also the layoff of 40 nurses at one of the sites, and the answers in terms of, the assurance previously come forth that no jobs will be lost, etc. And there was a non-answer, to be honest with you, as you might have expected. And then the question in terms of, the assurances with regard to future kinds of, potential staffing, et cetera, et cetera. It was just some very focused questions around the guarantees that have been raised and could there be further guarantees. And obviously it's a lot of deflection in terms of the fact that it's early days and we have to see. And then also the question of whether or not it's going to be privatization and the concerns that this opens up for a lot of privatization. As you can imagine, Christine made some strong commitments around the fact that we are a public healthcare system, blah, blah, blah. But again, making no concrete statements around how it might or might not actually work into the future. And then she did raise the opportunity for saying, small groupings of multi-stakeholders. So it could be a GP, it could be other clusters of it, could actually come together and apply them to be identified as a health unit. And again, no guarantees in terms of whether or not and how they would be designated, but she says it's early days, we'll be working together. So certainly the opportunities for what would be, what is currently already private providers, but coming together then to become a cluster. And again, no details yet. So I think it's, as we say, early days, but certainly you get the NVPs that are really gearing up on those two issues, the potential layoffs and the closing of hospital beds, and then the whole issue around privatization being, very front and center.
Hi, Durhane. I can hear you. It's Louise. Who else do we have on the call?
Hi, it's
Kim
me,
Steele.
Kathy Bernard.
Hi, Kathy. Who else?
David McMullen.
Hi, David.
Robin Sully. Hi, Louise.
Sorry, who's that?
Robin Sully.
Hi, Robin.
Hi, Louise.
It's Antonella. Hi, Louise.
Hi.
And Liz is
Allison
here.
from CCSN.
Sorry, is that Allison?
Yep. Hi again, Louise.
Hi, Allison.
Hi, Louise. Liz is here as well.
Hi, Liz.
Hi, Louise. It's Christina.
Hi, Christina.
And hi again, Louise. It's Rose.
Rose.
Hi, Louise. It's Kim. I'm not sure if you got me before.
Hi, Kim. I did not. Anybody else? Well, we got the gang's all here. I guess what I'd like to suggest is a little bit of an agenda. I think it would be good if we could just have a chat about the legislation itself, what it actually does and doesn't seem to say, and then the implications. And I know, Durhane, you were starting to talk about some of those implications coming out of that. Then I'd like to have a bit of a specific chat about the cancer side of this, because I think there may be some discrete issues in there for those of us on the call engaged in that area. And then I thought we could talk a bit about strategies that we may wish to employ and communications out to our membership and all the things that are related to that. Other things we should put on the agenda? Okay. Legislation. Have all of you had an opportunity to take a look at the draft legislation?
Yes.
Okay. So I'll just give my few cents, and then everybody can we'll go around and everybody can add more cents to this. My read of this legislation is that it is extremely vague in terms of what, in fact, it is going to do. It does say, as I read it, that there is an intention to roll together a total of 20 agencies under the direction and management of a super agency with a board of directors. Other than that, it is entirely vague to me as to what the role. Well, it's clear what the role of the board will be, in the sense that it'll be management, supervision, direction, and so on. But it is entirely unclear, really, how the 20 agencies that are going to be brought together are going to be, how they're going to be drawn into this. What does it mean for each of those agencies, both in terms of the way they do business now, and how they're going to be managed, how they're going to be managed within each agency, or whether in fact those agencies will even exist as such, or whether they'll disappear entirely. It's extremely vague about detail in any of those details. So that I definitely do think that it leaves the door open for almost any kind of configurations of managing those agencies, including public management, private management, or some combination of public-private partnerships. I think that's entirely unspoken, but for that reason, definitely open to interpretation. The only thing I've heard the Minister of Health say that I think kind of adds to my distress about it is that whenever she's asked about this issue of privatization and is that where they're going, etc., all I've ever heard her say is people will continue to be able to use their OHIP cards to get health care in the province the same way that they do now, which really doesn't answer the question as to whether we're really going to end up with two parallel healthcare systems, one that's privatized for those who have money to pay, and one that's public for those who don't. And indeed, those who use that public system, I'm sure she's quite right, they'll still use it through their healthcare card. Of course they will. Question is, what will they get? How will they get it? What is it going to do in terms of delays? And how much of the services that these 20 agencies are doing are going to be divested? Will they continue to be doing the same things, etc.? So I don't know. That's about as much as I could make of it. I'd be glad to have others add any other observations that they've made from looking at the legislation. Anybody else?
Maybe I'll start, right? And this is Christina. I'm going at it more from a cancer perspective, because that's the agency we represent and the constituents we represent. And I'm glad to hear Louise say that, because I thought it was just my own unsophisticated reading of the legislation that I didn't understand where the details were coming in from, because I too thought it was very, very vague. And what concerned me was that really it's about, I wasn't sure about the governance and how the mandate would shift if there was still going to be, like CCO had clear goals and deliverables that talk to cancer objectives. And the way it reads now, there's no assurance or guarantee that is this CCO now going to become a department under this separate agency where then they will have goals and deliverables towards cancer, or is this board going to draft, like how is this board going to draft their evaluative and measurement processes? Are they going to be measurements that will help improve cancer care in Ontario? And those are just huge questions that carry a lot of risk, and that's where my main concern comes in.
Mm-hmm. Anybody else want to add anything about the legislation itself? Okay, so I think I would suggest that in terms of implications, we have implications in terms of process, and Christina's talked a bit about that, but we'll talk more. There's also implications, I guess there's implications in terms of content. I guess content is more what Christina's talking about. What are these agencies going to continue to be doing and not doing? And process is, how are they going to be doing it? How are they going to be managed? How are they going to be run? And what are they going to be doing? So I think all of those things are entirely vague to me. But one of the things that I would think we would all be wanting to, a theme we would want to all support is the theme of patient engagement at the highest level of decision making as this moves forward. As Durhane mentioned early in the call, no decisions have been made. Everything's kind of up for grabs. It's early days, and there'll be lots of discussion and consultation. Well, okay, but where is the decision-making role for patients about their healthcare systems, both in cancer and generally outside of cancer? So that, I think that's a theme that, you know, keeps coming up for me. Where are we in the decision-making process here? And of course, I would suggest that we want a role on that actual board. And of course, at any other level of meaningful decision making below that board. So I don't know how others feel about that, but that's kind of my first pass at our engagement in process. And then of course there's the engagement in consultations, and that's the other thing I would think we want to ensure is that there are, before they make any decisions, that there are public consultations about whatever it is that they're proposing to do. I don't know how others feel about that.
It's David here, Louise. I would agree.
Yeah.
Anybody?
Likewise.
Yeah. If there's anybody who thinks that's wrong, or if there's, please let me know.
I think that makes sense.
Sorry, was that
it's Antonella, because I'll just jump in, but yeah, I think that's a great point. And things like I'm still processing the information and thinking about its implications for us. But one of the things is, you know, how are they going to assess the potential new lead groups or applications that they get from these lead groups? Like who's evaluating these? Who's making these decisions? How are patients and patient groups being engaged in all of that? I really think being involved at the decision-making level of the Health Ontario makes a lot of sense for so many reasons, because it's going to have so much trickle-down effect in who's delivering our services.
Yeah. Others?
I do think there needs to be, if we're going to be asked, we need to ask from a ask perspective. We have to be clear that we're asking for both a cancer and non-cancer.
Definitely. I want to have a discrete conversation about cancer, because I think there's something specific I'd like to say about that. But in the meantime, sort of from a bird's eye view of the whole thing, so much is being left out in terms of how they're going to proceed. We can't actually, and I'm sure they've done this quite intentionally, we can't actually criticize very much, because there isn't very much there to criticize except the entire concept of bringing all these organizations under one roof. And, you know, it's hard to even argue about that one way or another if we don't know what that roof is going to look like and what it's going to mean. So to me, the only way we get into that conversation meaningfully is if we can be at the decision-making table. So as these things do get decided and rolled out, we're there to know what they are, make our voices heard, and warn our communities if necessary if what's happening here is not appropriate. So
exactly.
Okay, so I guess so those are two things then I think that at least we can put down as action points for us as one, and we'll decide how we actually go ahead and do this. But the first is to make sure that we're clear that we want patient engagement at the board level and all the other decision-making levels that are created under the super agency. And the other is a call for public consultations before any decision making is done, before there's any decision making about how they're going to proceed and what their processes and content of this super agency is going to be and how it's going to impact each of the agencies it's taking over. Mm-hmm. So I wanted to say something about cancer, and the rest of you may have something else to say about any of the other agencies, but if you look at the list of agencies that they're putting together, cancer is actually kind of out of place in a sense with the roles of the other agencies there. The other agencies are broad health administration agencies. The LHINs, Health Quality Ontario, eHealth, they are very broad-based health administrators of different kinds. But the cancer agency has a very discrete mandate, as Christina was mentioning, and it's broad, but it's discrete to cancer. It's broad from engagement in research, engagement in prevention, engagement in treatment decision making, in access, in monitoring. It's really, but it's all kind of cancer. I mean, it has broadened out a bit to some kidney area, but it really is basically what it says it is, a cancer agency. And so to me, it doesn't really fit in the same way that the others do. And I think there is a question about whether it can be administered in the same way. For me, yes, you do want good health administrators, of course, in cancer, as you do everywhere, but you do need expertise in cancer to be managing that agency. And I think that's different in a way than the agencies and the expertise required for the rest of the agencies. I don't know, Christina and others in cancer, do you feel the same way about that?
I completely agree. And when we met with Frangel last week at the at legislative event, she hinted that might be something that that could be saved out of this. If there was enough, like CCO could be something that could be exempted from this, and that could be changed from this legislation if there was enough banding up together and advocacy.
Yeah, and somehow I suspect, I don't know if it can be saved, but we may be able to get some kind of a different approach to that agency.
Right. I mean, it may not end up called CCO, because more likely it won't, but it could be Ontario Cancer or something like that. Yeah. So that kind of jumped out at me when I looked at the whole list. That was the one that really seemed different. So that's another point we may want to make, and we may want to deal with that almost separately. I think we may need a separate track of strategies and tactics just on that. But it was something that really jumped out at me. So are there other issues at this point that we'd like to raise? Yes, of course, as I mentioned early in the call, there is the issue of layoffs and how it's going to impact employees, etc. But I don't think that's our kind of, I don't think that's the message, I don't think that's where we want to put our emphasis. We want to put our emphasis on ensuring that there will be good health care and healthcare agencies for people in Ontario. I think that's obviously where we get.
Well, it's Gerhan. I just want to, sorry, I had to jump in and out of the call because I was on the train, so I didn't catch everything that was said. I will say very strongly point made by the health critic NDP that layoffs And if we're talking about frontline care, you can't do it without frontline people. And so I think that was important to raise. It's not to say, okay, we're just going to preserve the same number of people to willy-nilly, or there's a guarantee in everybody's jobs. But I do think it's important that we address those issues. I also think, obviously, and Christine stood up and read strong endorsements, and she only read snippets from the OMA, from the Ontario Hospital Association, from the Nurses Association, etc., all endorsing this. So I think some of the things that might be beneficial to do is actually liaise with these other associations. I mean, as we have done in other areas, find out where their interests are, what it is they're saying, and how it is that we can make sure that they're aligned with calling for that patient engagement or whatever else we're putting forth. The other thing we did raise, again, because it's fortuitous in Rare Disease Day, and we had all the parties there at our Rare Disease Day breakfast lobby, is that there is an opportunity to create a rare disease network within this constellation of Health Ontario. So I hear what Louise is saying, that, what you may have is something like a cancer network or cancer, what they have in Europe, or these reference networks, centers of excellence, et cetera, that are in fact integrative, comprehensive, et cetera, picking up on her language. So there was certainly some support for the notion of having these different kinds of networks that would pick up on what they're trying to do. So to me, two things. One, understanding where are the other professional associations, how do we align with them, how do we make sure they endorse the patient voice, and secondly, what are the kinds of things? Christine said clearly that, they're going to be looking for proposals that come forth in terms of, the example she gave was networks of, maybe regional kinds or locally geographic kinds of networks that would be cross-disciplinary, integrated, et cetera, et cetera. But I think if we want to put some things on the table, it's an opportunity to bring together, obviously, other stakeholders, including the healthcare providers, et cetera, to consider what some of these ideal configurations within, Ontario Health would look like.
Yes, I think that's I think in terms of our next step, you're absolutely right, Johann. We have got to see what the other important stakeholders are thinking, and my suspicion, and I might be wrong, but my suspicion is a lot of the support for this is because there has been a profound dissatisfaction, and I think completely rightly so, with the way the LHINs have worked, even with the way CCO has worked. I think there's been a sense that eHealth hasn't worked as well as it should. I think a lot of these agencies definitely have problems and definitely need to be improved. And so I'm sure, and of course they're working, the theme that we're hearing from Christine Elliott is this theme of teams and, filling gaps and all of that kind of stuff. And of course that, who would say no? That's the thing about it, is it's been so vaguely put and it's been framed in a way to be so positive that, how would you argue against it, But I think that the real intent is to create a much more private system than we have now, much more private health than we have now. And I think that's a subtext that is underlying this, that, she's not denying, but she's avoiding skirting that point whenever it's raised. So I agree. I think that's a very important thing for us to be doing, meeting with other organizations and we should probably make a list of all those. And you did mention some of them, Johann, but it'd be good to have a good list of those organizations, and we can decide who can, who either has connections or would be willing to meet with them. I wonder, I know that there's a meeting at CCO on Friday of their biosimilars team, and maybe we'll be able to get some information coming out of that meeting. But I suspect that CCO is going to say not very much about anything because they're so under the gun that I doubt they're going to want to, give away anything that could hurt their position more than they may feel they're fire already. But certainly, you know, I think that there are a few people who will be at that meeting and can at least see what, if anything, we can learn from them. And I can also tell you that a couple of us have already asked for, I'm sorry, I'm gonna have to take this for 1 second.
Duran,
Yes.
can I just ask you a question? I just want to ask you a question. Sure. So the network of specialties.
Sorry.
Yeah, go ahead. I'm sorry. Yeah.
I'm just going to ask Louise. I'm just going to ask Duran a question. So the networks is an interesting concept. I mean, if we're looking at, because they probably do want to change the name of CCO. I mean, they've said they want something different, but perhaps we're talking about a cancer network. I know that from the hospital perspective, they're thinking more regional networks, looking a little bit at BC, which I understand has got, and I'm not familiar with it, but I understand that they've got a little bit of a mixed bag of regional and perhaps a bit of specialty networks that they're looking at. Do you think, was there any sense of how they were envisioning these networks beyond, I mean, was there any talk of specialties? Again, it's very vague, and just talking about sort of geographic or just a general reference to this network idea.
Yeah, it's a very high level discussion at this point, as you know, and they kept saying the details aren't there, which I think other people were suggesting is a huge opportunity, obviously, to make some propositions. I think to Louise's point, if there's an opportunity for consultation, then that would actually help in terms of the discussion. But as you know, if they don't provide the opportunities for consultation, we can certainly create our own consultations and present them with some of those strategies. But again, it sounded very clearly they're looking at geography because they want to get to, and they kept talking about frontline. So the whole notion is that we need to make sure that we're able to engage those health providers at the front line in terms of being able to have better access to, you know, the whole range of services. And I think that's part of the thinking. I mean, I don't think that precludes having specialty networks, as you say, because those definitely will still need to exist. But the opportunity then is to think about how do frontline networks also interface with them. And again, there wasn't a whole lot of detail, but I think it's an interesting question that you raised in terms of what they're defining. I'm sure there are other people that may have thought this through more, but I would say probably not. I think it was an opportune time to make a political discussion. I think, as everybody heard in the webinar that they gave, that there's a very little detail. I think it's not just that they're not releasing the detail. I think they don't have the detail yet, but I do think that they will be very quickly doing it. So I think the opportunity for us to imagine, you know, what are some of the things that we really want are going to be there. But I myself, you know, as I say, we're very focused in terms of the rare area. And Dr. Khan from Kids, who's going to be the new president there, he was there, and he very much echoed the opportunity for us to consider, you know, having something that would be an integrated network available right across the province, thinking about that hub and spoke model, and being able to provide that as a bit of a proposal for how, you know, these services could also be aligned and having still centers of excellence, but also then getting into what seems to be the big concern is how do we get to the primary front lines?
Okay, thank you.
Yeah.
That's really helpful. That's very interesting. So we could look at then specialty. We may look at specialty areas as opposed to geographic, or integrating those somehow in a network.
Well, we can certainly make those arguments for sure. I mean, I think everything's a bit up for grabs at this point. At least they say it's up for grabs. I think there's a lot more cooked behind the scenes than they're letting us know. But at least in theory, yeah, I think we could certainly make all those arguments. So can we just talk for a few minutes about immediate next steps? I was just starting to say that a couple of patient groups, cancer patient groups, including Save Your Skin and one other, have asked to meet again with France Gélinas and see if we can get any more intelligence from her, from what she's been hearing about what we may be able to do, certainly on the cancer side and in general. So I hope we'll be able to get that meeting, and as soon as I know about that, I'll let people know. And that doesn't, of course, preclude others from also asking for meetings with her. I don't know how available she's going to be, but hopefully we can have another chat with her. Should we be...
Louise?
Yeah.
I'd love to join that meeting because I was just there with her last week and she was talking about this. So it might be nice continuity.
Yes, absolutely. As soon as I get more information about it, I'll let you know for sure.
Thanks, Louise.
So sort of that's going on, and I guess I'm hearing a couple of sort of immediate next steps. One is a list of other relevant stakeholders that we should be trying to. Could we take a few minutes? And I know, Durhane, you want to start your list. I know you mentioned the Nurses Association.
I only mentioned the ones that she raised and sort of read these glowing endorsements from, who might, as you say, you can imagine that, there's not a lot of happiness with the current system. And obviously everybody wants to know when this is going to happen, so they're going to say good things anyway. So nobody's going to come up and say, oh my gosh, don't do that, because, we don't want to be axed out of the system. But the nurses, the hospital association, definitely the medical association. I would imagine, though, also, all of the other professional groups that are there, the Pharmacists Association, et cetera. I think we need to have a sense of, where they might, be thinking about in terms of their own, role there. But I think from one of the first things I was saying as well is to make sure that we get strong agreement from all of them. The patients have to be at this. We need to put that out there strongly, have that echoed by all of the other groups.
I agree. The other group that I've noticed that's been speaking quite a bit about this is the Ontario Health Coalition. And so it might be worth, because I think there's a strong union presence within that coalition, and the unions are very important in all of this as well. So they might be another group that we should consider engaging in all of this. Any other obvious ones to anybody else?
Us as well, for us as well, we're also going to be networking back into our specialties. So we already have specialty networks. We have the metabolic networks, we have the, pediatric networks, the genetics networks. So I think we want to make sure that we understand kind of, where they see themselves ideally positioned. As I said, we have this framework for a rare disease network that was produced, at the end of the last government, and we think it provides sort of a model actually for how it could actually be inserted right in something like this. And so I think we want to make sure that we understand where, other of these specialty networks are actually not. You're saying cancer, which already has been already has an existing kind of a coordinated structure. Many of these others do not. So I think we want to see if there's an opportunity then to think about how it might fit in.
Yeah, absolutely. So I'm wondering how we would like to, is there general agreement that a very important next step would be to kind of try to meet up with the other large stakeholder populations and see if we can get some commitment from them to support our patient engagement in all of this process and engagement for public consultations? Is there general agreement about that?
This is Robin. I think it is a good idea. I think this idea of consultation, starting with a consultation, is really important. And whether they have not been consulting, and perhaps, as John said, is we need to open up the consultation. So invite them to be part of that too. I don't know if we have to talk to them all, but we should talk to all the key ones to get a sense of, I'm sure there's going to be some commonalities in what we're going to hear from these organizations, because I doubt that very many know very much, have very many details either. Because to my knowledge, I just on the hospital side too, there hasn't been any consultation institutionally either. So I think a lot of people are, as Ron said, maybe making, of course, people would like to have a better health system. We'd like to have improvements, which is what they're saying, but we don't know what that means. I don't know if anybody does. So I think the idea of beginning with consultation is really important, whether we try and get them to consult, and I don't know if there's much hope in that, or whether we facilitate some kind of consultation.
I personally don't think we should start by being the facilitators. I agree with Durhane. If they aren't going to consult, then we should definitely create a consultation process. But my thinking would be, this is much bigger than just us. So I would say that I would go with Durhane that we should be reaching out to as many of the other large stakeholder groups as we can, and see if they want to join us in a call for public consultations. Because I think...
Louise, I agree with that. I'm sorry, I wasn't clear. I agree with that. I agree with you on that.
Okay. So do others agree? Is there anybody who thinks that's a bad approach? Have the better approach they think we should adopt?
Well, do you think, Louise, that we should perhaps carve off the cancer piece, or have it?
I do in a sense. I think the issue of public consultations generally, and the inclusion of patients throughout the decision-making processes that they create within this super agency, I think we should all be supporting that. All of us who agree with it should all be supporting it. And I don't think it's cancer specific, but I do agree with you, Christina, that you and I should, and anybody else on the call who wants to work on specifically the cancer piece. I think we do have some specific cancer asks that are that we need to be talking about as well. Absolutely. But just in general, I'm wondering how we would like to work on getting meetings with the nurses, the pharmacists, the hospital association, the Doctors Association, Ontario Health Coalition. Is there anybody who has connections to any of those already?
Well, maybe the easiest way to start, actually, you write a letter to each one of these associations indicating kind of what our position is and calling upon them to support it. I just spoke Monday at one of the meetings with the OMA. We presented, they invited us in to present, et cetera, et cetera. And I think everybody there was certainly buzzing about it because it was pre the announcement. But maybe it would be good to just start with a draft, write a letter, tell them, what we are interested in, certainly calling very much upfront the need for consultation and patient engagement, and then inviting them to, meet with us. So maybe just getting the letter out there so that we've got a foot, into, their work. Obviously they've been much more consulted than we are. If they at least, were called upon to write letters of support. I'm actually quite, I think it's quite interesting because obviously the government reached out to these associations to say, give us a letter of support, because, they wouldn't have turned around and just spontaneously have done that, with the announcement when it was, and they chose not to ask any of the patient groups in terms of their support. Now, mind you, there are many, many patient groups, so maybe they felt like they would have been too difficult to do all, but, let's start with that and the associations, get them to understand where we're coming from. So that maybe what we need is a common, is a list of all the associations, and then we might even divide them up a bit. But I think everybody should be on that signatory.
I think that's a great idea.
I also think that to get at some of these associations, if any of our groups, I know we do have a medical advisory committees. These people will be able to, these associations, they're their docs, they're their constituents, so they will listen to them much more than they will listen to us. So if we send this letter with the signatories of our medical advisory committee members, then it might get a little bit more traction.
That's a great idea. Yeah, I think the more signatures we can get on the letter of, of people who are supporting the same position we are, obviously the better positioned we'll be. So, all right. So the first, is there somebody who would like to take a stab at a draft of this letter?
Louise, it's David here. I've got a question. I think reaching out to these groups is very us, but who are we? Do we have a name of our group?
No. I think we're just a coalition of interested patient groups, concerned patient groups.
Okay, is that how we should describe ourselves?
I think at this point, I don't think we should start becoming create ourselves a big bureaucracy. I think we should just be a group of concerned patient groups and list ourselves and just list the names of the organizations themselves.
Okay, and obviously when we meet with the other stakeholders, we would represent the coalition, basically. The coalition.
Sure. I think the first step is to get somebody to be willing to draft a letter and get it out, so we can all sign it. Anybody we can get, including medical advisory board members, etc., that we can get to sign it, we do. And then if we get a commitment from them to meet, then we can decide amongst ourselves who's available and willing to go to those meetings, and that person will have the endorsement of the group to go ahead. Does that make sense?
Okay. Yeah, it does. It's a start. Yes.
Exactly. That's all we can do. This thing is a very big elephant. We're going to have to bite it off one piece at a time. And I'm very sure that there's lots of, there are going to be lots of other stakeholder groups talking about this, wanting to do things about this. And, hopefully if we get letters out to them and they realize that we're interested as well, that there may be opportunities for some synergies and working together. So I still didn't get any volunteers for a first draft of this letter. Volunteers.
Louise, it's Christina. I'm happy to do it, but I'd rather save myself for some of the cancer-related stuff.
Okay. Anybody else who's not in the cancer gang that might be willing to take a first crack at a letter?
It's Antonella, and I'm not in the cancer gang, but I might be the only one on the call who can make it on the call. But I'm happy to take a stab at it, Louise, if you want me to start and send you something.
That would be great. Why don't you do a first draft? You can send it to me, and then we can make a list of the groups we think we'd like to send it to and send it around to our gang, and they can edit. Thank you, Antonella, for that.
Easy. Yeah.
The second, I think for those of us in the cancer space, I'm wondering if we need a separate call just to talk about what we'd like to do on the cancer side.
I think that'd be good, especially if CCO is going to become merged with something else. That's a specific area where we should focus our attention.
No question, we probably have some very specific asks in that area. So let me get Chantel to set us up a call that'll be specific, and we will. I'm happy to share whatever we come out with the rest of the group, because you may have some good ideas for us as well. But I think probably we need to kind of roll up our sleeves on this one on our own. All right. So our first step is to draft a letter, get it out, and try and get some meetings with other relevant and interested stakeholders. As I've mentioned, we're trying to get a meeting with the NDP. I'm wondering, do we think at this stage we should be writing and asking for a meeting with the other parties?
I don't think it could hurt, could it, Louise?
I don't think it could hurt. I don't see anything wrong with it.
So,
I think that's a great idea.
yeah, Robin, I believe John Fraser is very interested in healthcare. He might be a good asset for us.
You know, we have a meeting next week on March 6th with him, and I think we could put this on the agenda just to feel it out to begin with, and then see what he would recommend going forward.
That would be great. You could take
And I
him
could-
on. Yeah.
I could put him, I could send a request for a separate, an additional meeting, because we just met with him last week as well, and we were talking about this.
Yeah, so let me just put a slight note of caution out, and not to say we shouldn't meet, obviously. So as I said, we had the opportunity to have a Rare Disease Day there, so we had all 4 parties there, and John Fraser as well was speaking. What we do know is they've got their own agenda. So before we get too caught up, even in the NDP as well, right? So we had Teresa Armstrong, who spoke very strongly, very passionately for us, but always have their own agenda to be inserted in. So I think if we're going to do this, we need to have our position somewhat clear first, and we need to make sure that we don't get sucked into their agenda, their partisan agenda. I mean, obviously we want their support. So I'm not saying don't meet, I'm not saying anything else like that, but we need to be clear what we're asking for, because they got their own agendas, as you know.
I agree. I mean, to this point, what I'm hearing we would be willing to talk about are patient, a public consultation, which is, I think, a very nonpartisan thing to ask for, and also patient engagement in all the decision-making processes. And I think the rest of it, you know, might be interesting to them. But at this point, I don't think we have more than that. Under the umbrella that we want here is that whatever they do will actually achieve better access and lack of gaps and all the other things that we think, you know, lack of hallway medicine and all the other things that we think patients really want and deserve. And I think that's all I mean, at this point, those are the only 2 messages we've crafted that I would feel comfortable delivering.
I agree, Louise.
Yeah, I agree strongly. I was just trying to think about whether or not we could actually have a little bit of an umbrella tagline. And the thing that came to me as I was listening this morning to the discussions, something like a Patients for a Healthy Ontario.
Sure.
Great.
Good play on words.
Yeah, absolutely. Okay, so I think it was Robin. You said you're going to be meeting with John Fraser.
We have a meeting with him next week, so I'm away I'm not available for a month. So,
but somebody is going to be there, and you'll be able to get them to put it on the agenda.
Yes, absolutely.
And Christina, you're going to try him out as well?
I can, yes.
That'd be great. And we're trying with the NDP. I'll keep everybody posted on how that goes. And certainly if anybody else wants to write to the NDP, that's just fine. And then who would like to write to the Minister of Health?
We actually met with her last week with CCSN and LCC. Had the chance to meet with her last week. So it might be a nice follow-up.
Yeah, you could do a thank you for meeting with us, and now a larger group has gotten together, and we'd like to have more of a conversation now that we've seen the legislation. If you want to do a little bit of a draft, Allison, I'd be more than pleased to have a look at it, and we could.
Oh, that was Christina, but I was going to suggest that. No, it's me. No, it's me. As CCSN and LCC have the chance to do it. So I think maybe Allison, you and I can work together with Jamie, and we can come up with something. But it's a good opportunity because we just had that meeting last week.
Exactly. That's a great thank you for meeting with us. And and now we need more. That's great.
Yeah, this is Allison. That sounds good, and I'll pass it along to Jamie as well. She was unable to sit in today, but I'll pass it along.
Yeah, I'll loop back with you guys separately.
Okay,
Perfect.
now, so I think that's probably a good start for the first hour of our conversation. So I will definitely get a separate call for the Cancer Gang, And should we set up another time to chat now with this group, or what's your pleasure on that?
It sounds like
it's always easier. Can you send something around? It's always
a doodle
little
poll.
challenging. Great.
I'll do a doodle poll for this group, and then I'll do another poll for the cancer group. We'll get a draft letter ready for the politicians. We'll get a draft letter ready for the other stakeholders, and we'll keep each other posted.
Louise, please include Martine Elias. I'm sitting in for her.
Oh, of course. Absolutely. Okay. Very good. And if in your travels, you come across others who are interested in joining us, just let them know, and we're glad to add them to the list. Okay. Well, thank you all for your time.
Well, thank you, Louise.
Thank you very much.
Thanks, everyone.
Right. I know.
Thank you.